This is Sekou Radio, Southwest Florida, Sarasota, Bradenton. And today our guest is Dave OCHSENDORF. Dave is a physical therapist. I would let him introduce himself. Dave, welcome to Sekou Radio.
Thank you for having me.
And
my name is.
Yes, go ahead.
My name is David OCHSENDORF. I'm a physical therapist at Siesta Key Sports and Physical Therapy in Sarasota, Florida.
Okay. Dave, do you mind giving our listener a short bio of yourself? What have you done and how long have you been at Siesta Key Physical Therapy?
Sure, yeah. My wife, Christy, and I, she's also a physical therapist, we opened our physical therapy practice 10 years ago on Siesta Key. So this month, actually, we celebrate our 10-year anniversary, serving Sarasota and Siesta Key residents for all their physical therapy and rehabilitation needs. And before that, we traveled for 4 or 5 years, taking short-term contract assignments in different areas around the country, mainly warm weather locations. But we got to learn what we liked and didn't like about a lot of physical therapy clinics and how physical therapists practice before settling here and opening our own practice. And I'm kind of working backwards a little bit, but I worked as an athletic trainer doing rehabilitation with athletes, a lot of time with football players and wrestlers, but pretty much every sport as an undergraduate and graduate student in Virginia before deciding to go back to physical therapy school. So now in 2020, I have been practicing in some form of rehabilitation in the rehabilitation field for 25, almost 30 years total.
That's great. So, Sekou Radios, we have a very good guest today. We're going to talk about physical therapy, the benefit of physical therapy, when to go, when not to go. And we're going to touch different sports such as running, tennis, basketball, you name it. So, Dave, if we have to give a physical therapy a definition, a simple definition, people will understand, what would that be?
Yeah, I think the most simplest way to define it is it's the treatment of an injury, disease, or deformity by physical methods, such as massage or manual therapy, modalities, and exercise, rather than, drugs or surgery.
Now, you have a practice on Siesta Key. What is the most common type of injury have you been exposed to?
So, for many years, I would say shoulders were the most common injury or body part that we would treat. There's a variety of different injuries that can happen at the shoulder joint. It's a particularly vulnerable joint, but we would see a lot of shoulders and knees. And we still see a lot of shoulders and knees, but we see a lot more joint replacement surgeries now. We see a lot of knee replacements and hip replacements and even shoulder joint replacements. So I would say that's the most common, and it may fit our clientele here, where we have a lot of active seniors who have retired to Sarasota, have retired to Siesta Key, and they're trying to continue with golf and tennis and walking and running and cycling, and they're trying to stay active, and in some cases they're suffering from arthritis, or the joint has become deteriorated to the point that they require a replacement, or in some instances they try physical therapy first to try to avoid having a joint replacement, and then if not, inevitably we see them after surgery.
Great. Let's talk about the shoulder. As a coach, I will think that ankles will be first, but you say shoulder. Why is the shoulder so prevalent?
Yeah, that's a great question, and I get asked that question fairly regularly by patients when they ask me the most common injury that we see. And I think that there's a couple of simple factors here. And number one is it's a very complex joint. It's a ball and socket joint, but really, if you were to look at the anatomy, there's not much of a socket there. It's more analogous to a golf ball sitting on a tee. So it's not really in the joint to where it has stability. It gets all its stability from muscles and ligaments surrounding the joint. And so in order for that to work properly, there are several different muscle groups that have to work in harmony. And they have a synergistic relationship where you're pulling in one direction while you're guiding it and stabilizing it from another angle. And if that gets even the slightest bit out of balance, it can create some inflammation or pain in there. And then individuals aren't sure how to treat that, or aren't sure how to rest, or which exercise to do, and then the inflammation can become worse. And one of the main reasons that we see this happening is, as we age, we have some of these normal postural changes where the shoulders become rounded forward and the head goes forward and the upper back becomes a little bit more rounded, and that puts the shoulder at a real disadvantage. The shoulder is designed to function the best when our shoulders are back and posture is in perfect alignment. But as we age, that changes, and also our living habits and our postural habits have changed with our lifestyles. We're on the computer a lot more, in front of the TV, reading. Everything we're doing is pulling us forward and not into an ideal posture. And then that leaves the shoulder vulnerable. So it's well documented, and it's certainly, I can support that from what we see in the clinic.
Right. So shoulder, a bad posture can affect the shoulder. That's what you're trying to say.
Exactly. And so we spend a lot of time on postural exercises and setting up postural programs for patients. Because, you can try yourself. If you're to stand up and stand with your shoulders rounded forward and sort of bent forward, and you try to raise your arm, you can only raise it about 90 degrees. Now, if you compare that to standing up really straight and pulling your shoulders back, now lift your arms and see how much easier it is and how much more range of motion you have. So that little adjustment in your posture can have a big impact on how the shoulder functions.
Right. So I like your analogy when you said shoulder is like a golf ball sitting on the tee. For someone like me who play golf, I can relate to that. So how would you define that in terms of shoulder muscles and the bones of the shoulder?
Yeah. So the ball is kind of the top of your arm. The arm bone, your upper arm, is called your humerus, and then at the top of your humerus it's a round ball. Right. And then that sits on a little platform that most people consider it a socket, but it's really just a little platform that's like a tee that the ball rests on. And that, again, is surrounded by a capsule of ligaments, and then on top of that, your muscles. Does that answer the question?
That.
Yeah.
So let's move to knees. Knees. What is the most? How would you define the problem with the knee?
Yeah, I think there's some similar issues with what we call the biomechanical considerations, or how a normal knee joint is supposed to function. But I think it's a little bit of a vulnerable joint also. A lot of we talked about too much sitting. When you sit a lot, you get really tight in the thigh muscles, the back of the thigh and the front of the thigh. And then that puts abnormal stress on the knee. And when I look around Sarasota and I see a lot of retirees and I see how they're walking, they've adopted a posture where they almost look like they're still in a sitting position. They're really bent forward at the waist, and they're bent forward at the waist, and their knees are bent. And when those two joints are in a bent position, there's constant pressure on the knee joint. So, and again, once you get some pain or inflammation started in the joint, whether it's from overuse, from a sports injury, or whatever it might be, if you're not good with your strength and your flexibility on both sides of the joint, then it becomes a chronic problem, and the inflammation lingers, and then you develop compensations where you favor that knee and try to protect that knee, and then you get even weaker and even tighter, and then there's a lot more compression on the joint, and it wears out quicker. So that's more of a simple description of what I see with a lot of arthritic knees in the clinic.
Okay. Now, how come shoulder and knees rank ahead of the ankles, where basically the whole our body rests on the ankles? Where is the ankle rank in this?
That's a great question. I don't know if it's a better design, but the ankle is quite stable in most cases, and it could be related to the environment that you're in tennis. You have a lot of lateral stress, moving side to side, very vigorously with a lot of power and a lot of stress on the sides of the ankles with all that lateral movement. And so you can sprain your ankle easily playing tennis and basketball. And then once you've sprained that ligament once or twice, the ligament is stretched out and it's no longer providing the proper support to the joint. And then you're susceptible to more injury and other issues. So I think it's a little bit more probably sport specific with ankles. They function pretty well, moving straight ahead and with a lot of the things they want to do. But if I was working with strictly tennis players or strictly basketball players, ankles would certainly rank closer to the top of the list.
So these problems, did you experience this problem with any age group or retiree, or what's the percentage? Young youth, young adult versus retiree?
Yeah, it's specific, I think, to the type of injury and to the body part. Certainly more of the arthritic problems, the more arthritis or degenerative conditions, we would call them, you would see with your seniors, and more of the sprain, strain type of injury you would see with your athletes, young, middle-aged, or old. And then I feel like all three groups, young, middle-aged, or old, are susceptible to overuse injuries when you're doing like a repetitive stress injury, where you're doing the same type of activity over and over. Some